Hi, Dr. Ian here from Lakeview Dental, and I want to talk today about tongue tie, diagnosis and treatment. And before we go, let me just do some legals. So any procedure carries risk, and before embarking on any procedure, you need to talk to a health professional who should be qualified and ask the questions. So let's just talk about tongue tie and diagnosis of it. Tongue tie needs to be a functional diagnosis. So in babies, we need to look at whether that baby is able to suckle or not. And if the baby's suckling is down to tethered oral tissue, either tongue or lips, and if the release of those can improve the suckling or not. So the presence of a tongue tie doesn't necessarily always mean a treatment necessary. So let's just go to a picture here, and that is a tongue tie, which is a tethered oral tissue. There's a little bit of a mucosa, sinewy little attachment that goes to the floor of the mouth, but also to the back. And the presence of it like this, it doesn't necessarily mean that it needs to be treated, because it needs to be a functional diagnosis. In other words, the test is, can they function or not? So in a baby, that can be snipped if needed to improve suckling. Now, there's other issues with tongue tie other than just suckling. We can talk about speaking, the swallowing, the functioning of the jaws and the growing thereof with the presence of a tongue tie or the lack of growth. But those need to be assessed at a later stage. And for a child, a baby, kind of it's just suckling. So, the same with lip tie. Again, it needs to be a functional diagnosis. If that baby can't latch on because they can't extend the lip, then we need to look at that. This is an adult that had braces. So at first, there's a significant lip tie there, as we can see. And what it caused, that really tough band has pushed those teeth apart, and she was given braces, and they've forced them together and tied them together with a permanent fixture on the back to keep them like that. But you can see how these teeth are kind of being pushed apart, so the angles are like that because of that sinew, that attachment there. And we have now released it, and the patient has reported that that angle of the teeth, even with that permanent retention, is kind of uprighted itself already. So that's a case of absolute treatment need. Now this is the other part of a tongue tie. The first part was what we call the anterior or front tongue tie, and this one is more back. And the diagnosis is literally on maximum opening. The tongue needs to be able to stretch at least 80% of the maximum opening. And in this case, you can see it's only about halfway there. So there were some other issues here that necessitated that treatment. So this is before. That is directly after. So you can see we've done some suturing in there. And that is a week later. Now, we do not use laser for quite a few reasons, even though it's very popular these days, both with the patients and clinicians. And the reason we don't like it, that's a laser incision on the lip. And you can see the tissue there kind of being different. And that's a week after. This is the tongue release of laser. And there's a lot of burning in there. And the reason it's popular because it doesn't bleed, because it gets burnt like that. Now, the lack of bleeding could be beneficial to the clinician because they can have a clear field of view, but not beneficial to the patient, because blood's actually a good thing. Blood has a lot of, when it breaks down, has a lot of byproducts that actually signals the body to start healing. And because of that lack of blood in there, the healing takes much longer. And that is what it looks like after a week. So this kind of healing takes up to 4 weeks, whereas the normal suture is about a week. So that's kind of why we don't use laser. It is too much of healing that's needed with that kind of burn. Much like if you have a little cut versus burning your finger, the cut will heal quicker than the burn. So that's kind of what we do. It's a little bit of a controversial topic, and we do it mostly from our point of view for jaw growth or the lack thereof, problems with TMJ, problems with breathing, and when we do orthodontic or orthopedic treatment. So that's kind of it in a nutshell for us, and thank you for listening. Bye bye.